Okay, sir.
Yeah. So get ready.
Okay,
All
sir.
are muted, only your audio is open. So, right.
Okay, sir.
So your name is Swapna Sree, remember?
Okay.
Okay. So squamous cell carcinoma. Squamous cell carcinoma. Card number 5. Yes, squamous cell carcinoma. This is patient and this is nurse. This is your card.
Yes.
So view full screen mode. So that is your card. So hide floating meeting control. Yeah, that's it. This is your card. So once you are ready, you can start.
Okay. How may I address you, sir, during the role play?
You can call me. You can call me Matthew.
Okay.
You can call me Matthew.
Okay.
Matthew is my name. Your name is Swapna Sree. Okay.
Okay. Okay.
Yeah.
Shall I start?
Yes, you can start now.
Good morning, Matthew.
Good morning, nurse.
My name is Swapna Sree, one of the registered nurses working in this clinic. How are you doing today?
Yeah, I am well, nurse. I'm doing fine, but the thing is, I'm a little bit worried. I don't know what to do with this one. I'm a little bit upset regarding this. What am I supposed to do, nurse? Because, I am 51 years old and I was
Okay.
overexposed to the sun in my teens.
Okay. Oh, well, Mr. Matthew, from your case note, I can understand that you underwent the surgery for squamous cell carcinoma. Am I right?
Yes, of course, nurse.
Yeah, today you are here to remove your stitches. So,
Yeah.
Mr. Matthew, I can really understand your worries. Don't worry. Do you have any idea about what is this squamous cell carcinoma?
One second. I will bring my artificial intelligence. Let it type. Please, 1 second. I forgot. I literally forgot. Artificial intelligence. Oof. Yeah. Yes, Simon's autopilot has come. Okay. Right. Sorry for the inconvenience. I wanted your speaking session to be typed and everything. Yes, you can start now. Swapna Sree.
Good morning, Mr. Matthew.
Good morning, nurse.
My name is Swapna Sree, one of the registered nurses working in this clinic. How are you feeling today?
Yeah, actually, nurse, the doctor, he had told me something called squamous cell carcinoma. And I don't
Okay.
sense anything other than maybe another name for skin cancer. That's what I think. I'm a little worried, nurse.
All right, Mr. Matthew. I can really understand your feelings. There is nothing to worry. Set your mind at ease. As you said, squamous cell carcinoma is a type of skin cancer, but it is not a life-threatening cancer. Are you with me, Mr. Matthew?
Yeah, of course, nurse. I can understand what you told very clearly.
Yeah. It is not a life-threatening cancer because it is affecting the superficial and middle layer of the skin. Moreover, it can treat completely with some measures like surgery and medications. Are you able to follow me, Mr. Matthew?
Yeah, of course, nurse.
Okay. From your case note, I can understand that you underwent a surgery. That means the lesion from your skin is removed completely. So there is no chance to spread that cancer to other part of your body. So I can reassure that there is nothing to alarm about your condition. Are you
Yeah.
with me, Mr. Matthew?
Yeah, nurse, of course, I am absolutely fine and I can understand what you're telling. But the thing is, I have a better understanding of what squamous cell carcinoma is now. And then
Okay.
I want to know if I am likely to need more surgery in the future to remove other lesions.
Mr. Matthew, I can really understand your concern, but try to understand that I am not an authorized person to explain more about your diagnosis. For that, you can meet your doctor and he will explain everything. Is that okay with you?
That absolutely fine, nurse. That's absolutely fine. And
All right, Matthew.
okay, is there anything else that I need to know?
Yeah, there are some things you have to follow that I will explain to you because this, as you said, you exposed a lot in your childhood. So there was little damage. So you have to inspect and monitor your skin regularly for any changes. I means any new spot or color change or any changes in texture. So you have to monitor your skin regularly. If you will find anything abnormally, you have to visit your doctor immediately. What do you think you can do it, Mr. Matthew?
Yeah, of course, nurse.
Okay. Then one more thing I have to insist that whenever you are going out you have to use some protective measures like a sunscreen, or you have to cover your full body. You have to use full clothings to cover your body. Okay.
Okay, nurse.
Okay. How is your wound, Mr. Matthew, now? Are you feeling any pain?
Actually, nurse, I always wear a high factor sunscreen, 30 or higher. I wear a
Yeah.
hat when I'm
All
out in the
right.
sun, but I think it's too late because the damage has already been done. And I spent too much time in the sun in my teenage years.
Yeah. Yeah. I am happy to know that you are protecting your skin when you are going out. But as you said, already there is some damage is there, but you can prevent further damage by using same protective measures. Okay, Mr. Matthew?
Yeah, of course, nurse.
So you have to monitor your skin regularly. If anything, you have to contact your GP.
Yeah, I'll make sure to look after my skin from now on. And as you asked me regarding my wound's condition, my wound has
Yes.
been fine. There is absolutely no pain or a
Okay.
discharge. But I still think it's too early to have the stitches out. Why can't I keep them for some more days, nurse?
And from your now almost 1 week after the surgery, this is the apt time to remove the stitches. Okay.
Okay, nurse.
The doctor already assessed your wound and he advised to remove the stitches. We cannot keep the stitches for a long time. If we are keeping, like, it will affect the wound healing. So now we have to remove your stitches and keep the wound clean and covered. Then you will be okay. Are you
Yeah,
agree to
that's
remove the stitches now, Mr. Matthew?
yes, of course, nurse.
Okay. Then you have to give the consent to remove the stitches in.
Okay, nurse. I'll give you my consent in writing or oral, whatever possible.
Okay. You have to sign in a paper. That is our official. According to our hospital policy, you have to sign the consent.
Yes, nurse. Thank you very much.
Thank you, Matthews. Thank you for listening patiently to me. Okay, I will make the arrangement for removing your stitches. Please be seated.
Yeah, thank you very, very much, nurse.
Okay, thank you.
Yeah. So that's good, Swapna Sree. You have done a good job. And
Thank you,
let me
sir.
tell you, you said case note. According to your case note is wrong. It's case notes.
Okay, sir.
Case notes, not case note. It is case notes.
Okay.
Notes, plural.
Okay.
Remember that. The
Okay.
next one is quality sentences. You are using very excellent quality sentences. There is no doubt regarding that. In the initial stage, you have done very well. You have used 2 or 3 sentences, which I really appreciated. They are commendable.
Okay.
And next
Okay.
one,
Thank you, sir.
some mistakes are there. That is not a problem, but quality is quality. So now next one, you said it can treat completely. You said it can treat completely. It can
Okay.
treat completely. No, it can be treated completely. It can
Okay,
be
sir.
treated. It can treat. What can treat? What can treat? It can be treated. Something can be treated completely. What? This cancer. Cancer
Okay,
can
sir.
treat completely or cancer can be treated completely.
Can
So,
be treated.
remember, that's a mistake you
Okay.
have done. Next one, you have excellent command over the subject. Command over the subject. That means you have a lot of idea regarding this particular subject called squamous cell carcinoma. You have wonderful idea. So definitely that's the reason why you are speaking very nicely. There is no problem with that. There is absolutely no problem with that. And then the way how you are talking, it you can people can understand that you are knowledgeable regarding this particular squamous cell carcinoma. If you don't have knowledge regarding squamous cell carcinoma, you cannot speak much, and you will be faltering, you will be confused, and you will be in a chaos, and you will not be in a situation where you can hold that command authority in the subject. So that's why you have good command, you have knowledge regarding that point. The next one, if you will find, if you will find, so this is wrong. Wherever
Okay.
if is there, will not be there. For example, the sentence is there, if you take medicines regularly, your recovery will be faster. But what you are saying, if you will take medicines regularly, no need of will with if. You understand now? There are two
Okay.
parts of the sentence. A sentence part, a clause with if and a clause without if. So if you come, I will help you. But what you are doing, you are using double will. If you will come, I will help you. That is wrong. In a sentence, only one will be there. Only one will be there. Only one future. If you come, I will help you. If you come, I will help you. If you do not come, I will not help you. So will be in the other part of the sentence where if is not there. Is that clear?
Okay.
Next one. There is some damage is there. What is this? There is some damage or some damage is there. Both are correct. Why are you messing up with these two styles? There is some damage. This is one sentence. Some damage is there is another sentence. Now you are mixing these two sentences and saying there is some damage is there. It's become nonsense. Absolutely nonsense. It's rubbish. It's totally meaningless. So there is some damage is there is wrong. There is or is there anything once you use either in the beginning or in the ending. Is that clear? For example, there is Mr. Peter is there. So there is Mr. Peter or Mr. Peter is there. There is a class or a class is there. There is a class is there. It is duplicated. So this should not be there. It shows that you forgot that you have already used the structure there is in the beginning of the sentence. Be careful. To be absent-mindedly, you are speaking which you have already used before. The next one is, are you agree to remove the stitches? Are you agree? What is this? Are you agree? It is not right. It is, do you agree? Do you agree? Not are you agree? Are you agreeing? Or do you agree? Are you agreeing means now. In general, it should be do you agree? Do you agree? That's the point. Do you agree to remove the stitches? The next one. Mr. Matthews, Mr. Matthews, Mr. Matthews. Why are you using this word Mr. Matthews so many times? Time and again, using the name of the patient, it makes, embarrassed. For example, I am Mr. Matthews, and every time you are saying Mr. Matthews. Okay, I want to ask you, how many people are here? You and I. You are the nurse, and I am the patient. What is my name? Mr. Matthews. What is your name? Swapna Sree. Did I always call you nurse, 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 Swapna Sree, Swapna Sree, Swapna Sree? So fine. That's why you should be, you are tested. If the patient talks, there is no problem. He may do anything, he may talk anything, no problem. But you should not repeat the name of the patient so many times. Only to confirm that he is the right patient. Okay. You to confirm, because you should not give a wrong diagnosis or wrong suggestions to a wrong person. So that's why to confirm that he is the right patient, to give the right diagnosis, right suggestions, right counseling. So you have to know that he is the person. Then only you can move further. So in the beginning, you have to ask whether he is the person or not. Once it is finished, then you will move ahead talking normally. No need to say again and again. Is that clear?
Okay, sir.
So how was the session? How did you get the feedback? What are your points regarding this? You have 30 seconds to speak.
Yes, sir, it was amazing, sir.
What did you learn? What did you learn? What did you find out?
So many things I learned.
Yeah, what are the so many things?
Sentence correction, grammar. These are the mistakes I am usually making.
These are the mistakes. These are the mistakes, not mistakes.
I usually make. I am trying to correct, but it will come. I don't know how to correct.
Okay, slowly it will come. No problem. Yeah, that's fine. Thank you very much for participating in the session. Yeah.
Okay,
afterwards, your session will be given. The written session will be given. Now, I am closing this session. All of you immediately rejoin the same link. Okay, I will come there. Rejoin after 1 minute. All of you. Because every video will be individual video. That's why.
Okay, sir.
Yes. So all the students are requested to rejoin the same link without fail within 1 minute. I'll close this session. You rejoin the same